Goeiedag! Good day, fellow South Africans and citizens of the world. And in an extraordinary development, the ANC government have recognized that Sangomas are fake. Yeah, they're just traditional healers, but they are fake. They do nothing. They don't call up ancestral spirits. They don't throw in the bones. There's a lot of BS. Making you wealthy overnight is a load of crap, as we all know. And being able to heal people with incurable diseases, well, we know where that goes. So, what am I talking about? I'm talking about COVID-19. Very, very interesting development. This is how they're trying to legitimize the Sangoma in the whole process. You gotta listen to this to believe it. It's quite extraordinary. 11 South Africans have now died after contracting the coronavirus, with the number of infections, that's the official number of infections, rising to at least 1,655. Now, as you know, this channel suggests that number is probably closer to 100,000 in South Africa now, and growing very, very fast. But of course, if I was in South Africa, I would be arrested for saying that, wouldn't I? Naughty boy. Oh, naughty boy. Well, you know what the ANC government and the SAPS can go and do? They can go and throw stones into the pool, because they'll have more success in making one of those stones float than getting me in a South African prison. Let's continue. Gauteng still accounts for the majority of COVID-19 cases, with 704 positive tests. In the Western Cape, there are 454 confirmed cases. Now, what is interesting about those numbers is that the greatest concentration of white people happens to be in the Pretoria area and in the Western Cape. And that's where the greatest number of confirmed coronavirus infections have been confirmed, with the very, very expensive testing regime they've had until now. And that's private. Remember, people are going to the public hospital system with symptoms of coronavirus are sent off home to go and self-isolate without having a test done. This is how crazy this system is in South Africa. And I've covered this in past videos. It's nothing new. This is old news, okay? More than half of those who've died from the coronavirus were from KwaZulu-Natal. Okay, well, guess why? They're elderly and they've probably got ailments which made them more susceptible. And this is why KwaZulu-Natal is such a... It's going to be catastrophic once it goes through there, because of the levels of HIV, AIDS, and TB. It's going to be absolutely catastrophic. The two latest fatalities confirmed on Sunday night have been identified as pensioners, the elderly. They're the group, and they would be probably white people, because they're the ones who could afford to actually have the coronavirus test done. Gauteng remains the epicenter of the coronavirus outbreak, while cases in the Western Cape have also increased. Now, I would suggest that the reality is very different. I would suggest that townships like KwaMashu, like Alexandra, that's where the epicenter of this virus is right now. It's bubbling away, boiling away. It's still going through its infection period. Boy, when it hits, we'll all know about it. We'll all know about it, believe me. Because there's going to be such a complete pandemonium with this completely clueless ANC government. Let's continue. With some of the lockdown regulations being relaxed to make sure vulnerable communities can still access food during this period, traditional leaders have also raised concerns. They also want to be recognized as essential service workers to help those who rely on traditional herbs and remedies. This is where the kicker comes in, okay? This is where basically they admit that the Sangomas and the witch doctors are a load of BS. Now, I can talk about that from a very personal perspective, because nearly 2 years ago, I got an email from some African fellow in South Africa who said he had seen the Sangoma, he had put a curse on me, and I would be dead and gone within 2 weeks, and my channel would be... That was 2 years ago. Well, Mr. Sangoma, my God is more powerful than yours. But this is what they're saying. Government, this is the ANC, said it was important that the role of traditional healers was redefined during this outbreak, as they, that's the Sangomas and the witch doctors, could help by referring patients to public healthcare facilities where they would get Western medicine. Think about it. If they showed symptoms of the virus. So that kind of says to me that this ANC government understand that Sangomas and witch doctors are a load of BS. You can go and throw your bones in your bloody toilet as far as I'm concerned, because they're just useless. Western medicine, you know, what can I say? I mean, it's ridiculous that the new National Health Insurance Scheme is going to recognize Sangomas and witch doctors as legitimate health practitioners. I don't know what to say. I'm gobsmacked. I'm at a loss for words. All right, guys, please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe. Bye for now.